Vasectomy is a procedure where we make a small cut into the scrotum using a scalpelless, needleless approach and clip small segments of the vas deferens off. And generally this procedure is done under local or with nitrogen in the form of NitroSeal or conscious sedation with propofol. You will need a driver if it's done under this way. Who is a candidate for vasectomy? Any male that wishes to no longer have any more children as a permanent solution for their fertility anxiety should proceed with vasectomy. Vasectomy is a permanent solution for your fertility needs. It will not affect orgasm, ejaculation, or sensation. It will change how much ejaculate comes out by about 5 to 10%. Most patients do this procedure and return to work 2 or 3 days later. Vasectomy is performed using a minor surgical poke in the scrotum. I do a needleless, scalpelless approach using a Metajet that delivers local. I can perform the procedure under local anesthetic alone, local with nitrogen or NitroSeal, which causes the patient to be relaxed, or under general anesthesia with propofol. The procedure itself usually lasts about 15 minutes, and there are usually 2 small little stitches that dissolve that are placed at the end of the case. The vasectomy procedure itself takes approximately 7 minutes. Vasectomy is a minor surgical procedure where we make a small poke in the scrotum and cut small segments of the vas deferens that drain the testicles. And generally I recommend that you shave your scrotum the night before the procedure itself, and if you're getting general anesthesia, do not eat or drink anything after midnight. The recovery process after vasectomy is quick. Most patients can return to work 3 days after the procedure. I recommend that you ice your scrotum and the stitches that are placed in the scrotum itself will dissolve. Patients need to follow back up approximately 3 months later with a post-vasectomy semen analysis to be cleared for unprotected intercourse after the procedure itself. I recommend the patients wait 1 week after undergoing vasectomy to start ejaculating. My recommendation is that you ejaculate 21 times prior to doing your post-vasectomy semen analysis. I also recommend that you avoid bathing or swimming for the first 3 weeks, as your incision may need time to be completely watertight. When can I have unprotected intercourse? Well, you'll have to do a post-vasectomy semen analysis to make sure that you no longer ejaculate any sperms. We will not clear you for unprotected intercourse until you have performed this test. The risks for vasectomy are bleeding, infection, scar, pain to the testicles, swelling or hematoma, and chronic testicle pain, which only happens about 1% of the time.